The local task force has a team of forecasters predicting COVID-19 and how many of us in our area will end up hospitalized because of the virus. So right now their models show a range between 1,300 and 3,300 patients a day being in the hospital with COVID-19 across all of the hospitals in our metro area. 1,300 people in the hospital a day is their best case scenario. 3,300 people a day in the hospital across all of our hospitals is their worst case scenario. And today I talked to one of the doctors crunching the numbers.
Dr. Welchie, what you've been researching the last few weeks?
You've heard Dr. Garza with the regional task force describe this somewhat like hurricane forecast. We knew that far out, they would be rough at best, but still it would give us some idea of what we should start planning for. You know, like a hurricane forecast, if you wait until you know for sure what's going to happen, it's too late to buy plywood and duct tape. So we wanted to plan well in advance to have at least some ranges of likely numbers of patients so that we could ensure that we had plans for how we were going to take care of our patients. Did we have enough ventilators? Could we get more? Did we have enough protective equipment? What could we get? And just start the planning.
Give people some of the basic parameters that are going into this equation.
Right. With the demographics of our metropolitan area is one of the biggest factors. That the 2.8 million people who live in the metropolitan statistical area, the MSA. We're looking at the person-to-person spread. Again, the initial estimates were based largely off of what's been seen in other regions. And then as time has passed and we're seeing how many cases were accumulating over time, we're updating those models to say, as we look at the interventions, the stay-at-home order, things like that, it seems like person-to-person spread is in fact reducing, and so we're building that into our models.
Would you say overall things are looking more positive or more negative?
Both from our best case scenario and our worst case scenario are looking a bit better. And as we continue to refine, as people ideally continue to do what they've been asked to do, stay at home, refrain from social behavior, wash their hands, things, then we'll see. But right now, things are looking better than I would have predicted a couple of weeks ago.
So that's good news. Things are looking a little bit better. During the task force briefing today, they hold one every single day. They said they have some new modeling. They need to analyze that, and they're going to get back to us later on in this week with new numbers possibly of how many hospitalizations from COVID-19 we can expect each day and that hospitals will need to be prepared for.